living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
The most important member of your healthcare team isn't your pharmacist, a nurse, or even one of your doctors. It's you. In fact, research shows the more involved you are in your own healthcare, the safer and better your healthcare becomes. Today, we will talk about why it's important for you to be an engaged and empowered patient. I'm your host, Sarah Medley. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Welcome back. When patients engage in their healthcare, it results in improvements in safety and how you receive your healthcare. I'm here this morning with Dr. Doug Kunzweiler, an emergency room doctor and Mountain Pacific Quality Health Chief Medical Officer. Good morning, Doctor.
Hello,
Thanks
sir.
for being here.
Pleasure.
So, we are talking today about patient engagement, and it's become something of a buzzword. You hear it a lot. What is patient engagement?
Well, it means the physician and the patient working together as a team. When I came up in medicine quite a while ago, the patient pretty much was told what to do, and that was that. They weren't given much information, they weren't given much opportunity to ask questions, and not too surprisingly, they didn't always follow through with what the plan was because they didn't understand it. So engagement, to me, means it's a two-sided coin. The physician needs to be engaged with the patient in the sense that they need to not only ask about their symptoms, but ask about how they feel about their health care and what their goals are, what their sense of well-being is and what that means to them, and what they're willing to do to achieve that. From the patient's standpoint, it means being an active participant, not just simply listening to what the doctor says, but asking them questions, making sure that you understand what they're talking about, making sure that you understand what the physician is trying to accomplish and that it fits with your goals. And that means asking questions, taking notes, being involved.
That's great. That really helps a lot. Healthcare is so complicated. We all know that.
Yes.
And it's intimidating for patients to communicate with their physician, and I'm sure you know that as well. We're afraid that you're going to think our questions are stupid, or we're not very smart, or we're challenging you as a clinician and a physician, and that's the last thing we want to do. So what advice would you give us as patients to help us better communicate with you as a physician?
Well, I think you should think of it in terms of it's my health, and it's, my life. And so you have a right to know what's going on. And the truth of it is that physicians want you to be successful. They want their plan to work. And in order for that to work, we've realized that the patients have to understand what we're talking about. They have to buy into what the plan is, and they have to help us by giving us the feedback that we need to tailor the plan to them. So it's your right to ask questions. It's important that you ask questions. And you shouldn't feel like the physician is going to think that you're stupid. The physician wants you to succeed, and he wants to make sure that you understand what's going on and that you can help him be successful.
Yeah, absolutely. So when I go to the doctor, I get a lot of information, and that information can be overloading to me and cause me to wonder, what the heck am I going to do with all this information? Help me understand how you make sense of all of that information.
Well, I think one important thing is, I talked about asking questions, but then also repeat back to the doctor or to the provider what your understanding of what they've said is. And that helps them realize whether or not you understand what's going on and whether or not they need to change their communication. So I think that's important. I think you should always feel free to take notes or to bring someone along with you who might be able to help catch details that you miss. It's important, I think, to ask the provider if there are other sources that you can read later to try and understand what's going on. But I think asking questions, feeling free to take notes, and to rephrase what your understanding of it is very helpful.
Well, and asking questions about the drugs that we take, I'm sure that's important too. From my reading, a lot of us are on one drug, and many, many of us are on more than 5 drugs. And so how can we make sense of the drugs that we're taking, and what do we do? What kinds of questions should we be asking you as our physician or our pharmacist about those drugs?
Yeah, I see people all the time that tell me they're taking the little blue pill and the little white pill, but they have no idea what they're for. And so if you're going to be an engaged patient, you have to keep track of the names of the medications you're taking and what they're for. You don't necessarily need to know how they work, but you should keep a list of your medicines, and you should keep a note of what you're taking them for. I think it's important to ask your provider why you're taking them, what the medication is supposed to do, what to do if it makes you feel bad. If you miss a dose, what should you do? I think these are all important questions. And when you go to visit your provider, it's good to take a comprehensive list of everything you're taking, including the over-the-counter medicines, because those are often important. Or better yet, just put everything in a bag and take them with you. And then, you can sort those out, and the physician can see exactly what it is that you're taking.
Absolutely. So we have just a minute left, and you're a practicing emergency room doctor.
Yes, I am.
And it's extremely stressful, maybe not for you, but for us as patients. So what advice could you give quickly about stressful situations in the emergency room? Should I become a patient there?
Well, I think, again, it's important to know who your provider is, what your past medical conditions have been, and to have a list of the medications. That helps the emergency room providers out tremendously. I think it's important to understand that the emergency department doesn't work the same way your doctor's office works. We're dealing oftentimes with very sick patients who are very injured, and so we have to prioritize. So you might not be seen right away, depending on what your condition is. But everything else still applies. You should still feel free to ask questions, to repeat back what your understanding is of your condition, and take notes.
Thank you so much. Up next, we're going to be talking to Dr. Sherry Howell, a primary care physician who has more to say about how you can be more engaged and an empowered patient. Stay with us.